Ectropion is a term that we use when we describe an eyelid, usually the lower eyelid, that hangs down, so it's pulled away from the eyeball. It's almost like having a loose set of windshield wipers. It doesn't wipe the tears effectively, and because of that, your eye can be dry, red, irritated, or you may have a watery eye. We can perform a surgical operation where I make a small incision right in the outer corner of the eyelid, and I tighten that lower eyelid to bring that eyelid back up against the eyeball so that it can work like the windshield wiper it's meant to work as, to bring tears to the inner corner of the eyelid so tears can effectively drain. That surgery can be performed in the operating room as well as in the procedure room. We can give you some sedation through the IV. You go off to sleep while I numb you up, and then I make a small incision right in the outer corner of the eyelid and tighten your lower eyelid. You will be bruised and swollen for approximately 2 to 3 weeks following that surgery.